think we're going to get started, so if everybody wants to take a seat. Thank you all for being here. You get the gold stars for commitment and determination for the last plenary of the day. My name is Nan Roman. I'm the president and CEO of the National Alliance to End Homelessness. I'm delighted to welcome you here today to the panel on family homelessness, examining the emerging evidence, federal policy, and promising practice strategies. It's not news, I know, to anyone here that poor and low-income families face tremendous obstacles with regard to housing. When I first started working on poverty issues in the 1970s, there was plenty of housing that was affordable to low-income families that needed it. In fact, there was a surplus of low-cost housing units, and as a result, there was not really homelessness, among other problems that we didn't have, certainly not among families. Since then, things have certainly changed. There are now only about 3.7 million low-cost housing units that are affordable and available to the 10 million households that need them. That means that we're nearly 7 million housing units short for the lowest income people. Of course, we have rental assistance to help people fill the gap between what they can afford to pay and what housing costs, but we don't have enough. Only 1 in 4 households that is eligible for housing assistance receives that assistance because there's not enough money. Not all of these millions of families that are affected by the mismatch between income and housing costs become homeless. Instead, they spend too much of their income on housing. It is generally accepted that a family should spend no more than 30% of its income on housing. Otherwise, they won't have enough money left to pay for food, transportation, health care, clothing, everything else that they need. Yet there's no state in the nation in which a person making minimum wage can afford to rent a 2-bedroom apartment for his or her family at 30% of their income. They spend much more than that. And the problem is concentrated amongst the poorest families. So 2/3 of families at 30% of area median income and below, so that's around the poverty level or even a little less, spend more than half of their income for housing. 2/3 of the poorest families spend more than half of their income for housing. So here we get to the crux of the matter, that paying this much for a place to live leads to great instability in housing and even to homelessness. And further, that homelessness and housing instability are not the exception to the rule among people who are living at or below the poverty line. They are the rule. Further, housing instability and homelessness have all kinds of bad effects on families and children. Kids don't do well in school, their health is affected, adults have difficulty getting and keeping employment or increasing their earnings. Obviously, this housing and income mismatch is a problem that concerns both HUD, which has responsibility for the housing, and HHS, welfare programs which have responsibility for incomes and helping people become self-sufficient. What have we been doing to help solve the problem for those families with the most acute housing-related issues, the homeless families? We have a homeless assistance system to support the 240,000 people who were homeless in 77,000 families last year. That system used to be focused mostly on short and long-term shelter, the latter called transitional housing. Crisis services were also provided. Now, however, a new intervention has emerged that we call rapid rehousing. Rapid rehousing is more successful than previous models and less costly. We see it in communities that are successfully reconnecting families to housing, using housing search and landlord negotiation, providing short-term rent assistance, delivering case management linkage to service, and paying significant attention to helping parents connect to employment. The cost of this is often quite modest, less than the cost of shelter or motel stay for 2 to 3 months. So this is an intervention that is clearly applicable to TANF. TANF agencies have the expertise in connecting families to employment. They provide the income and work supports families rely on until they transition into the workforce. Further, many TANF agencies are already taking responsibility for the homelessness of families, but using less effective, often more expensive approaches like shelter and motels. The funds they're expending can be redeployed to help families quickly reconnect to housing and employment, to significantly improve their outcomes, because rapid rehousing doesn't just end homelessness, it improves children's health and helps them do better in school. It's a platform for the other things that families need to do to thrive. Our speakers today are going to talk about rapid rehousing, TANF, homelessness intersection, and what we can do to stabilize these incredibly vulnerable families and improve their outcomes and those of TANF and those of the homeless programs. The biographies of this fantastic panel are in your program, but it's really an honor to be sitting up here with them. And I'm just going to briefly introduce them one at a time, and we're going to start with Mary Beth Shin, who is one of the preeminent researchers on family homelessness in the country and a huge thought leader for all of us working in the area. Thanks, Mary Beth.
Thank you so much, Nan. So today I'm going to tell you something about families who are homeless and how similarly they are to other families who are poor. Okay? I want to convince you today that there's a great deal of overlap between families who use welfare benefits and families who experience homelessness, and that TANF policymakers and administrators have important tools to combat homelessness. In particular, many TANF families experience homelessness. Most families who experience homelessness are homeless only briefly. Homelessness, like welfare usage, is a state that families pass through. It's not a permanent trait or condition. You can think of it more as a river than as a lake. Homeless families look much like other poor families, but they're typically younger and have younger children. Much family homelessness stems from housing affordability, as Nan has just described to you, from poverty and from the costs of taking care of those young children. And as a result, supports that TANF can provide for income, for housing, for employment, for child care, can end family homelessness. So here's some data from Milwaukee that shows that many TANF families experience homelessness. In the year prior to applying for TANF benefits and the subsequent 2 years, a quarter of TANF applicants were evicted or lost their home. Almost half doubled up with other households because they could not afford to pay the rent. And a quarter became literally homeless, went to shelters or the street. Note that far more poor families have experienced homelessness over time, over a 3-year period, than at any particular point in time. That's because most families who experience homelessness are homeless briefly. This chart is based on an analysis of patterns of shelter use by first-time shelter entrants in 4 jurisdictions, in Philadelphia, New York City, Columbus, Ohio, and the state of Massachusetts. For about 3/4 of families, that big blue group, homelessness was temporary. Total shelter usage varied by jurisdiction. It ranged from about 33 days in Columbus, Ohio for the total homeless episode to up to 131 days in New York City. And the vast majority of those families had just 1 episode, and then they were gone. For that small red sliver, 2 to 8% of families, shelter use was episodic. These are families that were in and out of shelter, and their total usage was 3 to 5 times as long as the temporary families, but it was divided up into 2 to 3.5 episodes, depending on the jurisdiction. Then the green group there is about 1/5 of families, and they were in a longer stay group. So they averaged long stays, half a year up to 1.5 years in shelter, and between 1 to 1.4 episodes. Interestingly, the temporary and the long stay families looked pretty much alike. It was that small sliver of episodic families that were more troubled. And that group was more likely to have interactions with other systems like Child Protective Services or behavioral health. But most families who enter shelter for the first time are not very different from families that use welfare with respect to their interactions with these other systems. Okay. These are data from the Family Options Study on which I'm working with colleagues from Apt Associates. And our study looks at families across 12 sites throughout the country, And these are all families who'd been in shelter for at least a week, so they're not really short stayers. Homeless families look much like other poor families, but they're especially likely to have young children. Most families were female-headed, but about a quarter were two-parent families, and another 10% had a partner who was not in shelter, usually because the shelters could not accommodate men. Most families that experience homelessness are small. 3/4 of them had 1 or 2 children, and most include very young children. Even though this is not a sample confined to first-time shelter users who would be even younger, and only a quarter of the mothers were 24 or younger, half of the families had a child under the age of 3. About a quarter of the episodes of poverty in the United States begin with the birth of a child. So it's not surprising that episodes of homelessness often begin when mothers are pregnant or when they have newborns or children are very young. These are now show you all the children that were in shelter with their families, not just the youngest. And we see that almost a third of those kids were 2 or younger. That's the blue group there. And more than half, if you include the red group, were 5 or younger with their families. Okay? Here are national data that show the same thing. They come from the last annual homeless assistance report, homeless assessment report to Congress that broke down shelter use by age. The graph shows that infancy is the period of life when a person is at highest risk of living in a homeless shelter in the United States. Let me say that again because it's so shocking. The age at which a person is most likely to be found in a homeless shelter in the United States is infancy. Rates fall a little bit, the next dot, when children are 1 to 5 years old, and they fall still further when they enter subsidized childcare in the form of public school. The implication is that help with the costs of childbirth and childcare could avert much family homelessness and give these younger children a better start on life. Here are some other characteristics of families in the family options study. As I've told you, most families who experience homelessness are homeless briefly, but just as you know, for welfare caseloads, those with longer and repeat histories mount up in the system. And so in the family options study, almost 2/3 had a previous episode of homelessness. Homeless families are very poor, with a median annual income in our study of under $7,500. Only 41% of the families were on TANF, which has the ability to increase family incomes, raise employment rates, and help with child care. So TANF programs could help end homelessness by reaching out to and enrolling families in shelter. TANF dollars can also help with short-term rent subsidies that could end homelessness with rapid rehousing, and they can provide supports for child care. Because much family homelessness stems from housing affordability, poverty, and the costs of young children, TANF has important tools to alleviate it. The next slide comes from the National Low-Income Housing Coalition, and it tells you what Nan told you earlier, that there's no state in the union where a full-time, year-round minimum wage worker can afford a 2-bedroom apartment, that's afford the fair market rent for a modest 2-bedroom unit, if that worker pays only 30% of income for rent. I'm lucky, I come from Tennessee, where a family only has to work 76 hours per week at the minimum wage to afford a modest 2-bedroom apartment. But the dark orange states, in those states, a family would need to work 98 hours per week or more to afford that unit. And in states like New York, California, and Hawaii, even 3 full-time year-round jobs at the minimum wage would not suffice if a family pays only 30% of its income towards rent. Thus, it's not surprising that numerous studies have shown that housing subsidies, such as Section 8 vouchers, which reduce a family's housing costs to 30% of their income, both prevent family homelessness in the first place and bring it to an end, whatever other problems families may have. Rapid rehousing programs, which provide short-term and shallow subsidies, that is, they don't bring the rent all the way down to 30% of income, are credited by many as the reason family homelessness did not rise particularly during the Great Recession. So this family options study is an experiment. We're currently comparing, we've randomly assigned families to 4 different conditions to receive deep subsidies, typically Section 8 certificates, to do rapid rehousing, to do transitional housing, which are programs that combine housing with services, and to usual care, which is typically not too much more than shelter or whatever other resources families can scrounge in the community. Preliminary data suggests that homeless families offered subsidies lease up at higher rates than to other poor families. Rapid rehousing got somewhat mixed reviews from our families in qualitative data because of the uncertainty engendered by quarterly recertification. But families preferred both types of subsidy to transitional housing. They were more likely to get into them. They were more likely to go. And by the time of this conference next year, we should be able to tell you how well these programs worked for a variety of outcomes, for ending homelessness, for promoting self-sufficiency, for preserving families, and enhancing adult and child well-being. So to go back to my take-home points, I hope I have convinced you that many TANF families experience homelessness. Our families, for the perspective of people who work with homeless families, are your families from the perspective of folks who work with TANF. Most families who experience homeless are homeless only briefly. They just need a little help to get out. Homeless families look a lot like other poor families, but they have younger children. They don't have, tremendous problems, or only a small sliver of them have problems that need more critical interventions. Much family homelessness stems from housing affordability, from poverty, and from the costs of caring for those young children. So TANF administrators, TANF programs have tools, important tools, that can help to end family homelessness, including supports for income, for housing, and for childcare. Thank you very much.
Push it again. There we go. I want to introduce Mark Johnston, who's the Acting Assistant Secretary at HUD for Community Planning and Development. Mark has also for years run the largest federal homeless assistance program, and he's really a tremendously gifted policymaker, so glad to have him with us.
Thank you for those kind words, and good afternoon to you. In 2010, the President unveiled the Federal Strategic Plan to End Homelessness. And I know there are a lot of plans out there, but this was the first one ever that was an actual plan to end homelessness of any administration. And it's quite a specific plan with particular targets. So this includes ending chronic and veteran homelessness by 2015, which is right around the corner, and it includes ending family and youth homelessness by 2020. We've seen a fair amount of progress on ending chronic or long-term homelessness and veteran homelessness, about 17% in the last 2 years for veteran homelessness and about 9% on chronic homelessness. We have not, frankly, seen that kind of progress on family homelessness, in large part because of the Great Recession that Mary Beth referred to. We are, however, we did a point-in-time count in 2013, as we do across the country every year, and we are at least preliminarily seeing some more encouraging indications in terms of family homelessness. Traditionally, many families have experienced homelessness by going through emergency shelters and often, as Mary Beth referred to, leaving the homeless system altogether. Others, however, would go from emergency shelter to transitional housing for a few months or years and then move on to some form of permanent housing. Moving through that linear model is clearly an ineffective and unnecessary obstacle for many homeless families and is very expensive. The notion of housing first is something that has been used in many communities over the years and is really being used nationally at this point. Not everywhere, but most everywhere. The notion of placing somebody in housing first and then focusing on the other issues that they have, given their tremendous need and their immediate need for housing. Many families over the years have benefited from this housing first approach by receiving permanent supportive housing. So rental assistance on the housing side, and a variety of needed supportive services. We have seen, though, and Nan referred to this, another model that's come forward in the last 3 or 4 years called rapid rehousing. We learned a lot about this recently through the Homelessness Prevention and Rapid Rehousing Program. It was a Recovery Act program funded at $1.5 billion, which shed a lot of light and a lot of important findings that we are now observing regarding rapid rehousing. We found, for instance, that in community after community, about 90% of the families that got some short-term housing and some light services, such as case management, even after that assistance was withdrawn, 4 months, 6 months, 9 months, 12 months after that, they were still housed a year after their last form of assistance. And the more astonishing thing for me is the relative inexpense of providing this intervention. It was about $1,200 a person, or about $3,600 a family. So we were able to solve homelessness, not poverty, but solve homelessness for these families, in that they have now been on their own for a year or more, 90% of the time, and it was only costing us, and has only been costing us, about $3,600 per intervention. So it's significant because while the Recovery Act program is now gone, there are a number of different resources that can and are being used to continue this effort. At HUD, programs such as the Emergency Solutions Grants Program. Clearly TANF is a vehicle for this. The VA has a program called Supportive Services for Veterans Families. So there are a number of different programs that are and can be used by those who aren't yet to continue this great effort. The challenge that we have at this point is that while we've seen reductions in veteran and chronic homelessness, and I hope we'll start to see reductions in family homelessness, we've really run out of money in terms of federal-wide appropriation levels. At HUD, in terms of our targeted homeless programs, we've been essentially flat funded for 4 years in a row. So the only way that we're going to be getting better results and continued reductions in homelessness will be much better use of existing resources. For many years, we looked at permanent supportive housing, that is, housing with the array of services that people need, as the ultimate solution. And frankly, it is the ultimate solution, but it's a very expensive intervention. It's typically about $10,000 on the housing side for a family, and probably $10,000 to $20,000, depending on the city, for the services. And at that level of $20,000 or $30,000 per year per family, it is just not a sustainable intervention. We have about 2 million homeless persons in the course of a year. HUD has only about 200,000 beds that are targeted to homeless people. So we have a gigantic gap. And fortunately, as Beth said, many homeless families leave very quickly on their own. And that's really the key, is to be thinking through in very strategic ways to whom should we be giving permanent supportive housing, which would be families that have disabilities, families that have been on the streets for periods of time, versus shorter-term interventions. While we have very limited funding at HUD for creating new projects, we are now sort of digging down into our reserves of existing programs and seeing how we can use them better. So a couple of examples of this are, we have about $400 million of our roughly $2 billion that is being used for transitional housing. And as we see more and more the comparisons of rapid rehousing, which are much less expensive and seem to be much more effective in terms of housing stability, we are encouraging more and more for communities to consider terminating their transitional housing projects and using that savings in our national competition to create new programs, whether that be new permanent housing or rapid rehousing. The other item is that we have in our roughly $2 billion, about $400 million is spent on supportive services, a wide range of supportive services, from daycare to drug treatment, mental health treatment, case management, life skills. And some of these services make a lot of sense that HUD would fund them, such as housing search, or perhaps even case management if we can't readily find a source to serve a variety of homeless families that have different needs. But other services such as daycare, drug treatment, mental health treatment are certainly not within the bailiwick in terms of our background and expertise at HUD. They really should be ideally funded by other agencies, other federal and state agencies. Our goal here is really to try to find other sources for these funds so that we can use those savings in creating new and additional housing. We've made some progress over the years. It used to be that 60% of all of HUD's homeless funding was used for services. With incentives, we've reduced that to under 30%, but we still have $400 million in services that otherwise could be used at HUD, the Department of Housing, to create more housing resources. So when we look at alternatives such as the Affordable Care Act, creative uses of TANF, which we've seen in many cities, New York and many others, there really, I think, is still room to be reducing the level of support that HUD is using for services so that we could continue to create new housing, because HUD is frankly the only federal agency that by law can create new permanent housing for homeless families. So in conclusion, I wanted to say that we can end family homelessness. 2020 is a very bold goal to do that. And frankly, it's an even bolder goal to be ending veteran and chronic homelessness by 2015. But we actually do know what the interventions are to make that happen. And we're just going to have to, at the federal, state, and local levels, think in very strategic ways on how we can best use very limited resources to continue making progress. Thank you.
Thanks, Mark. And now we have Catherine Gale. Catherine is a policy director at the U.S. Interagency Council on Homelessness, but she's also a person who has years of experience on the ground designing improved systems to address homelessness, many of which involve TANF. So Catherine will talk to us about that.
Thanks, Nan. So I should start by saying what the U.S. Interagency Council on Homelessness is. It's the entity that essentially unites and brings together in a single platform all of the federal agencies that in any way touch upon homelessness, including, of course, HUD and HHS, both represented here today, but all of the agencies that in one way or another need to work together to align our vision behind the strategic plan that Mark mentioned. That plan, the Opening Doors Plan, as Mark said, sets a bold but we are convinced doable vision of ending homelessness for all populations in the country, the focus on family homelessness, family, children, and youth by the year 2020. And the plan embodies a lot of strategies and goals around how we're going to do that, that include how we improve local and civic and federal collaboration, how we expand the range of access to housing, how we promote meaningful and sustainable employment, as was mentioned, is so critical, health and stability, and particularly how we develop and strengthen the local response to prevent and end homelessness in a coordinated fashion, and I'm going to talk a little bit more about that. The plan has the unflagging support of the leadership of the council, Secretary Shinseki, who's with the Veterans Administration, is the chair, Secretary Donovan of HUD, and all of the members of the council are behind this. But we know that as much as we coordinate together at the federal level, and we're committed to doing that, that it's the work that happens on the ground and locally that's really where we're going to end homelessness. So we look to you all as our partners in this approach. And we also know that to do that means that we have to look critically, both nationally and locally, at how we're invested, how we're using data to assess needs, costs, and outcomes, and creating the willingness to engage with stakeholders to make the necessary changes. As Mark said, we've seen over the last 4 years that family homelessness is essentially flat. Now, that's actually pretty good news considering that we're coming out of the worst recession in 70 years. And we think a lot of that does have to do with the kinds of investments like the Homelessness Prevention and Rapid Rehousing Program and other Recovery Act investments, including TANF ECF funds that some of you may have worked with. So we found some strategies that prevented family homelessness from rising. But now we have to start to do something to really bend that curve. That flat line can't stay flat all the way to 2020. We won't meet our joint goal. We've got to start to bend it down. And to move that needle, we have to ask some important questions. we have to ask those questions so that we create a systematic, coordinated response rather than a programmatic and individualized response. I think some of what you heard from the other panelists is that we've had an approach that was a little bit scattershot. Some families got a lot, some families didn't get very much, and the approach wasn't targeted to the needs as we've now seen them coming out of the data. So what are the key questions we have to ask? Well, one, at the local level, we have to ask, how do families with a housing crisis get the help that they need? Is there an identified place for them to go? Is there information available? Do the entities like yourselves who work with very low-income families who may be facing a housing crisis have that information and, better yet, have the resources to try and stem that crisis? And I hope that Mark Greenberg will talk a little bit about the specifics around how the TANF resources can be used for some of the things I'm talking about. Some families are going to have to come into a temporary housing situation, whether it's a homeless shelter or a DV crisis shelter. And in those cases, we have to ask the question, what are we doing to get families back out as quickly as possible into stable housing at whatever level of depth or support that needs to be? And so the point that was made earlier about really kind of being able to move quickly because these families are very similar to other low-income families, the thing that makes them different is, for the moment, they don't have a place to live. When we help them get a place to live, they may still have many other needs, and you all and we need to figure out how to address those, but we've addressed the immediate issue that created the homeless situation, i.e. the lack of housing. So how do we do that? And how do we right-size then the investments that we're making at the national and the local level in order to support the kind of investment picture that goes with the pie chart that Beth showed you, that the families that maybe don't have the deepest needs and can be helped with a little bit of support, get that little bit of support, and we target those deeper resources that Mark talked about to the families who maybe need something deeper. So the good news is that we have more and better data to help us think this through. We know a little bit more about the families that experience homelessness, and we know a little bit more about the way that the existing set of resources doesn't necessarily meet that need as best as it can. As Beth talked about, the Culhane research in the 4 communities pointed to not only is there a fairly small number of families who we see on a repeated basis with lots of deep needs, it also pointed to that they were the least likely to actually get the deep resources that we had. So we have some work to do about thinking about how we appropriately serve and how we kind of turn the model on its head so that instead of bringing families into a system outside of the broader system of services and try to deliver help and then figure out the housing at the back end, how we instead think about we need to help a family get housing and we need to help get them linked to the services in the community that can continue to support them in whatever ways they need to take the next step. When we do the opposite, which is what we've done a lot in transitional housing, as Mark described, we may deliver very high-quality services. But if those services aren't available later when the family is housed, we've missed a chance to connect them up. And likewise, if we've invested deeply in a small number of families, we've missed an opportunity to help a very large number of families who we might have been able to help. I want to make the point also that rapid rehousing, this approach of helping the family to get rehoused in the community with a level of investment and support that's commensurate with the need, is not one size fits all. And that's also a change in some ways from what we've done before. We can offer rapid rehousing in a model that sometimes is called progressive engagement. That is, we can help a family to get rehoused with a little bit of assistance, which might involve a deposit or assistance finding a landlord who will rent to them, a few months of subsidy while connecting them to services. And we can still be there to provide additional support if we need to. We don't have to be committed to a particular length of time in that case. So we can be more agile and more adjusted. But if we're going to make the commitment to reinvest resources on focusing getting families into housing, then we're going to have to make sure that those connections to other supports and services are in place so the families can keep the housing and continue to make progress. So we also have to ask the question, are we doing the best we can to connect families to community-based services to support their ongoing stability. We need our housing programs to partner with our other services, with employment programs, with TANF agencies, with child care and Head Start, so that that range of services can be delivered, as Mark said, by the people who are the experts in doing that, so that the housers can work on the housing. The reality of making this kind of shift is really being able to understand which resources can work in which way. And so I'm looking forward to Mark Greenberg talking a little bit about the specifics of TANF. I want to talk a little bit about communities that have done this and a little bit about what that looks like. So when communities look at what the stream of resources that they have are and how they can use them together, they have a better opportunity to be able to address the range of needs that they have. In Salt Lake City, and I understand Utah is at least present at the conference. I don't know if there's folks from Utah in the room. They've moved to a broad approach in which families are routinely, rapidly rehoused using a variety of resources. Some of them are HUD resources. Some of them are TANF resources. They've connected their services, the employment services and the housing search services together in order to help families get out and then be able to help them maintain that housing once they're there. And they found that their success rate is high and their returns to shelter after are very low. And assistance typically lasts for, it's my understanding, 4 to 5 months, but again, there's flexibility about what that range can be. Likewise, in Mercer County, New Jersey, they've made essentially a wholesale move at this point to a rapid rehousing approach for families. And as Mark said, kind of the encouragement to really look at the transitional housing model, they've decided that they're not going to continue to use that model because the rapid rehousing model is working so well. And not only is it helping the families to get housing, they're actually seeing improvements in the employment rates as well. In addition to TANF, though, there are other kinds of resources at the local level that you might want to look at as you think about how to do this. So before coming to USICH, I was working locally in Alameda County, California, where we were using child welfare dollars, the Title IV waiver dollars, to be able to do rapid rehousing for families that needed to be able to have a place to live in order to complete the reunification process. That was an example of a mainstream agency and our local housing agencies coming together and dividing up the responsibilities so that the housing agency does the housing-related case management and the child welfare agency delivers the rest of the services. I want to conclude with one final thought. As Beth pointed out in the beginning, the data that we're getting from the national studies, like the research that she's been involved in and other researchers have been involved in, is incredibly important to informing our strategies. But we don't need that kind of rigorous level research at every community level in order to use the data to be able to work together. Every community has a homeless management information system. After many years now, we're beginning to see very good data starting to come out of those. Every community and every state have databases that look at TANF, that look at child welfare, that know who those folks are. You all have the opportunity to come together and ask some of the questions that I just asked to you. Who are these families? Are they in both of our systems? What does it take to actually rehouse them? And what is it that we're doing that can be more successful? We can answer the questions about, are these families really returning? Sometimes there's concerns we're setting them up for failure, but I think that the data shows that we're setting them up for success. So I encourage you to use your data, to look at what the research says, to look at the models that are here, and to begin working at the state and local level to figure out how we all join together to end family homelessness. Thank you.
Thank you so much, Catherine. And finally, we have Mark Greenberg, the Deputy Assistant Secretary for Policy at the Administration for Children and Families at HHS. Mark has been a longtime poverty warrior working on the issue and a great thinker on it, so we're pleased to hear from him. Thank you, Mark.
So thanks very much, Nan. Thanks to my fellow panelists for being here to join in the conversation today. For the next few minutes, what I want to do is to focus specifically on the role that state and local TANF programs can make in contributing to efforts to end family homelessness in the United States. Yesterday, we heard about the potential lifelong effects of sustained levels of unrelieved stress in early childhood. One of the clear implications of that work is that where we have opportunities to help families avoid or reduce serious stressors in the lives of young children, it's very much in our interest to do so. And one of the most significant stressors that a family with children can face is a period of homelessness. Besides our concern about children, we have a shared interest in promoting sustained workforce participation by parents. But homelessness, as those of you who face this every day know, risks disrupting or preventing workforce participation, impairing the capacities of adults to effectively attain and sustain employment. So there's much reason to be asking what's the role that TANF programs can play in efforts to address homelessness. As I think the TANF agencies in the room probably all know, hopefully all know, we put out an information memorandum in February on the potential for TANF to support efforts to reduce family homelessness. In the information memorandum, we described the case for doing so. We highlighted the ways in which doing so can be an allowable use of TANF resources. We described a set of examples of states and communities that were currently engaged in efforts to do so, including several that Catherine talked about in her comments. We've subsequently heard that the release of the IM spurred discussion in a number of states and communities about what was currently being done, whether there was reason or an opportunity to do more. If your state hasn't yet had that discussion, we hope that you'll be having it soon. Placing a priority on addressing homelessness in TANF isn't just about the commitment of resources. There are multiple ways in which the TANF agency can be contributing to these efforts. For example, you can look at your application and intake processes, see if they include needless procedural barriers that may prevent a homeless family from accessing assistance. As Beth noted, the recent HUD study found a 41% participation in TANF by homeless families. That's actually higher than the overall participation rate for poor children or eligible families, but given the clear need and the probable eligibility of homeless families, it's surely reasonable to look at existing procedures and ask whether there are current barriers of entries that ought to be addressed. You can look at your application and assessment processes to see if you're currently doing adequate screening for family housing stability, whether there are preventative services or assistance that could help stabilize the family situation and avoid a risk of homelessness. You can look at your relationships with existing homelessness service providers, local domestic violence service providers, to ensure that they have needed information about how to access benefits and services, and you can develop memoranda of understanding or other agreements to simplify and expedite access. And if you're not already doing so, you could get actively involved in your local continuum of care effort and support the planning efforts to develop a coordinated point of entry structure. So having noted that there are a set of things that can be done that may not necessarily involve commitment of new resources, there are others for which resource commitment is necessary. We are mindful, as we know you are, that the reality in many states is that you face significant constraints on resources, that the block grant funding levels were established in 1996 based on spending levels from the early to mid-1990s, that there's been no adjustment for inflation since that time, apart from the time that ARA funding was available. Accordingly, we recognize that for any possible use of TANF funds, you or someone or some set of people in your state or county is necessarily having to make hard decisions about the best use of limited funds, often in a context where it's only possible to spend more in one area by spending less in another. Still, as you consider the purposes of TANF, your current allocation of block grant resources, it is appropriate for you to ask what share of funds are currently being committed to efforts to address homelessness and whether the balance has been struck appropriately. As I think everyone here appreciates, under federal law, states have enormous flexibility in decisions about how to spend their TANF funds. Subject to a few qualifications, states can spend their funds in any manner reasonably calculated to accomplish a TANF purpose. The expenditures may or may not fall within the definition of a non-recurrent short-term benefit or within the definition of assistance, but it's clear that expenditures to prevent families from falling into homelessness can be allowable, as are expenditures to help families meet housing needs during a period of temporary homelessness, expenditures to help families enter and retain permanent housing, and a wide range of services for families that are at risk of homelessness, are homeless, or have recently been homeless. In many communities, ARA funds spurred the creation or expansion of rapid rehousing efforts, as Mark talked about. But with the end of that enhanced ARA funding, communities face the challenge of how to sustain services over time. And as you've heard, in many communities, there's an active discussion about how to be striking the balance between rapid rehousing and transitional housing approaches to determine who will benefit from which services, how to use resources most effectively. In these discussions, we think there are two particularly important roles TANF can play. First, TANF non-recurrent short-term benefits can fit well with a rapid rehousing strategy because they can be used for up to 4 months of such benefits without implicating all the requirements that apply to TANF assistance. As we've clarified, that doesn't mean that the rental subsidy period can only be 4 months, though it does mean that the benefits become assistance if TANF is used for longer than the 4 months. Second, while there are tremendous benefits in helping families get out of emergency shelter and into stable, non-temporary housing, it's fundamental that if the family is going to be able to sustain its new housing arrangements, it is very likely that the parent or caretaker will need to get connected with permanent employment. And here, TANF agencies ought to be able to play a key role in providing or connecting newly rehoused families with employment services, whether or not those families are receiving TANF assistance. In HUD's family options study that Beth talked about, only a small share of families that were receiving rapid rehousing assistance were also receiving self-sufficiency or employment training services provided through dedicated links to other agencies. Numbers for such linkages were also low for transitional housing. Given the significant expertise that TANF agencies have in employment linkages, there is a clear opportunity for a partnership that combines rapid rehousing with rapid reemployment efforts. It's also been suggested to us that where a TANF agency is operating a subsidized employment effort, use of subsidized employment could provide a key part of ensuring that newly rehoused families are rapidly connected with employment, with case management and support services calibrated to meet family needs. Let me make one last observation about employment. When we were developing the TANF information memo on homeless families, we searched and we talked with a number of colleagues to explore if there were ways to strengthen the employment discussion in that IM. We were surprised to not find a stronger research base to draw from. It would surely help our efforts to have more research in this area, and even where rigorous research is limited, it'd be helpful to know more about promising practices and approaches. So we would encourage TANF agencies to be in active communication with their regional offices about their experiences and learning, and to identify and flag for us the research questions on which additional learning would be most helpful. So to conclude, if you've got outstanding questions about allowability, about the research, about the promising approaches, please let us know. We look forward to continuing this exchange with you in our continued efforts to reduce and to ultimately end family homelessness. Thanks.
Well, thank you very much to all of our speakers. That clearly a very well-informed and thoughtful and creative group trying to approach this difficult problem. We're ready to take questions from the audience. If there are any, you can go to the microphones, and also we may get some questions as well from the webcast, but we have a question now.
Yes, I do have a question, and it's probably would go to Mark Johnson from HUD. It seems to me I heard something about an evaluation study between HUD and the VA to address veterans' homelessness.
HUD and VA pooled their funds together to look at the long-term impacts of veterans who received HUD VASH vouchers. So that's permanent supportive housing, where HUD provides a Section 8 voucher and the VA provides outreach, case management, and longer-term clinical services, so that we can see what the long-term impact is of those clients in terms of employment, mental health status, substance abuse use, et cetera. So that is in the middle of it. We're not going to get some results for that for several more years.
Okay, thank you.
We have another question?
Yes. Hi, I have a two-part question. I was wondering if, doing the work that you do you have information on the homelessness of people that leave prison, that leave the mental health facilities? And it was a third part that went with that, because what I'm finding is that a lot of people contact me to say, oh, I can't find housing, I can't get a job or whatever because I had a mental health crisis and now I'm out of a job, or I just got out of prison and I'm now considered disabled and it takes almost my entire check to find a place to live. And so they have a lot of issues with that. That was the first part, so if you could answer that.
So that's more often the case with adults who are homeless on their own rather than as parts of families, because they may be parents, but they haven't had kids with them in those institutions. And certainly re-entering the community after an institutional placement is a risk factor for homelessness. And Housing First programs have been very successful in marrying housing and services for folks with those kinds of experiences.
But some of them are pregnant and have their children during that time, and so they do have families.
Yeah, and those folks are at enhanced risk for homelessness and should get priority for whatever services folks can provide to them.
I will say for HUD's larger programs, such as the voucher program, there's a lot of discretion given to the local public housing authority as to the entrance limitations for families coming in. And often public housing agencies will have a provision that if there's been an arrest record, a conviction record, that they will not be selecting those clients. In the homeless programs, we're sort of the opposite. We're really looking for the people with the most barriers to serve them. So one approach would be to be connecting with your local continuum of care, which is a loose affiliation of organizations, city and state and county agencies within your community, nonprofits, foundations, et cetera, where they actively talk about how to best engage people that have become homeless, including those who are coming out of prison or mental institutions.
My second question, oh, were you ready to say something?
I was just going to comment on, also just briefly, that I think one of the features of the rapid rehousing programs is they're really recognizing that people that they're trying to place in housing have barriers, such as they just are reentering, they don't have income, they have bad tenant histories, bad credit histories. And so a big feature of them is to try to clear these barriers up front, also develop relationships with landlords and identify landlords that will work with them. So pretty much most of the people who are being helped through these rapid rehousing programs have serious housing barriers, and a feature of the programs is to help them get over those barriers.
Yeah, and some of those people are not illegal, but legal aliens that are having that same type of issue that I meant to add to that list that have been contacting me. But my second question is also, I have people that contact me and say things that I don't really want to go to a homeless shelter because they're going to separate my family because I have a child, a son usually around the age of 14. So they'd rather be out in the street. So what do you do? What can, your programs do to help prevent that, because they don't want to be separated and they're homeless and they can't do anything about it. And they can go from, I forgot the term now, when you go from house to house, but people don't really want you in their house, from house to house and stuff like that.
You want to start? I'll go next.
but I might steal your thunder then,
That's
because
fine.
in the Hearth Act, which passed 4 years ago, which reframed some of the way that homeless programs are structured, one of the things that it makes clear is that it is not okay to separate families in a shelter setting. And so that's something that needs to be brought back to the communities and people need to be educated on. There are other issues sometimes in terms of the way that buildings are structured or programs are structured, which doesn't mean that that's always an easy fix, but it's very much a conversation we really encourage communities to have. So I think that's important. It's also true, though, that many families don't relish the idea of going into shelter. And so part of having, I alluded to it earlier, a kind of a coordinated entry point and assessment and a way that people get information is to figure out whether there are alternatives to families having to come into shelter. We often find that families are temporarily doubled up, or they may be living in some kind of temporary situation, that there's a way to assist them from having to come into shelter. So involving shelter providers in the community, both around the discussion around access and not having unnecessary barriers to entry, but also figuring out what the ways are to help divert families who don't necessarily need that shelter bed, and we can help them in another way. And that's one of the things that TANF agencies could also participate in.
How easy is it for you to get the count of the double up people? Because I'm hearing that those people are not always counted as homeless.
Well, that's certainly true. There's no readily available source to identify who's living doubled up because they're not identifying themselves. The point-in-time counts that HUD does are for people that are living on the streets or living in some sort of a homeless situation, such as a shelter or transitional housing. There are federal programs that do have people living doubled up as part of their definition of homelessness, but there are no good numbers whatsoever as to what those are. I think the best benefit that I've seen in terms of having doubled up persons in a definition of homelessness is at the Department of Education, where they have school liaisons that will help those kids get reconnected to housing. And because education is an entitlement and is a readily available entitlement, I think that's a great resource.
Okay, thank you so much.
We have another question.
Yes, thank you for a very interesting panel. I was very struck at the difference between the value of rental subsidies, which amount to $10,000 per year per family on average, roughly winning the lottery from the perspective of a very low-income family, versus the rapid rehousing. I think you said it was one-off costs of about $3,600. I'm wondering, because of course Section 8 lists are in many cases closed, or people have extremely long waits to get onto them. I'm wondering if there's any vision of an intermediate housing subsidy that would fall somewhere between that $10,000 per year and the $3,600 as a one-off that might be in your minds or being discussed at some level.
Well, let me start, and I'm sure there'll be some other observations as well. I was recently in Tacoma, Washington, meeting with the public housing director, and he is doing just that. He has an office that has windows all around it, and he says, I see, this is metaphorically, but I see hundreds of faces looking through my window wanting that Section 8 voucher, and I don't have enough vouchers to go nearly to all the people that are looking in my community. So he is choosing, rather than creating new Section 8 vouchers, to do rapid rehousing with his resources. He's one of the public housing agencies that has a distinction called Moving to Work, which gives him that flexibility. So we're going to be learning a lot about how to use alternative resources, or using our traditional resources in very different ways through these Moving to Work communities. Another example he shared there that directly affects families was he looked for the elementary school that had the most homeless kids in it. And it was such a high turnover rate that the overall school had a turnover rate of 140% a year, because families would move into a shelter for a couple of months and then move out to some other school district. And so the kids were not learning, the teachers were completely frustrated because they weren't able to teach. So he dedicated 25 housing units for these families, if those families would actually, the parents would go to PTA, if the children had a desk in their home to study, if they would not move out of the school district. And I was flying home that evening, and the woman next to me on the plane said, I'm from Tacoma. And so I mentioned this great guy, and he said, oh, Well, he's got a connection with me. I run the Children's Museum, and those kids have to come to my museum for educational purposes on Saturdays. So there are very creative things going on out there that we're going to learn a lot, and then we'll be able to apply, I think, hopefully over time to more places.
I can also just mention that I'm a commissioner on a housing commission of the Bipartisan Policy Center, which is just a bipartisan group trying to come up with some creative housing solutions. But the idea, that group actually, our recommendation was to provide housing assistance to everybody below 30% of area median income. But in addition, we proposed for people between 30 and 80% to have this sort of crisis intervention, HPRP type intervention. I think the evidence about rapid rehousing as a less expensive, we know that Section 8 ends homelessness for families. Section 8 is the best solution. It works better. But clearly there's something else we could be doing. It's just how to, manage this.
And I just wanted to make the point that the 3,600 figure that Mark mentioned is an average, and that, in fact, it isn't a one-size-fits-all. So it's not 3,600 or 10,000. That the beauty of the rapid rehousing model, if it's used in sort of a progressive engagement strategy, is that you can start by helping the family get moved in and whatever that investment is, but it doesn't mean that you have to back away the subsidy before the family's prepared to stabilize. So you might be looking at some families who really all they need is a deposit. And I will just say, if a family is in shelter now because what they're saving up for is a deposit and that's what they need to get out, it is a much better investment to pay that deposit for the reasons that were talked about. And then beyond that, if families need longer term assistance, rapid rehousing could be greater than that.
Let me just add as one more point. So as Catherine suggested, and certainly, or says, I mean, certainly one of the great virtues of the rapid rehousing framework is the flexibility that it offers in making judgments both about the length of the subsidy, the depth of the subsidy, and the ability to make judgments based upon family circumstances and based upon what's learned over time. So there's tremendous opportunity in that flexibility. There is much that we wish we knew more about what works best for who and when, but nevertheless, there will be tremendous learning opportunities over time. At the same time, as I emphasized in my comments before, in the end, ultimately, for the family to reach a point where they're not going to need a sustained subsidy, there really does have to be the employment linkage and the employment connection, that's going to be the only way that the numbers will work in the long run, which underscores how crucial building that part into the rapid rehousing effort is.
Yes, we have another question.
I guess I wanted to start by saying that the point that you made that the one-size-fits-all and the progressive engagement is a point well made and well taken, so I just wanted to point that out in terms of rapid rehousing. But I was wondering two things. First, my understanding is that the rapid rehousing programs are time-limited. So in communities, I'm thinking of New York specifically, where the housing market is highly competitive and expensive, how do you kind of address that time-limited aspect? Because I know in the past with the Advantage programs, there kind of were some serious, I guess, shortfalls to the program design. And then the second question is in terms of, are there any studies or is there any research in the pipeline that addresses some of the child outcomes in terms of school attendance or readiness or achievement or anything like that when a family is rapidly rehoused?
Well, for the second part of that, we will have some data on child outcomes out of the Family Options Study, which looks at rapid rehousing in comparison to long-term subsidies, typically Section 8s, and also in comparison to transitional housing and to usual care, which is mostly shelter. And we know from some studies in New York that during the period that kids are homeless, their achievement plummets, and then they bounce back but not all the way after an episode of homelessness is over. We know from other research in school systems around the country that lots of mobility for kids is associated with poor achievement. So to the extent that kids could get stabilized and not be turning over at 140% a year in a school, that's important to kids' achievement. In terms of how well a temporary subsidy works in a really tough housing market, I think I'm a little less sanguine than some of my colleagues about the virtues of rapid rehousing. I think most families who come out of shelter don't come back. And so one would expect that families who get rapid rehousing would come back at even lower rates. And just how well it does compared to deeper subsidies, I think we don't quite know yet. It's a promising approach because most families don't come back, and so a little extra help might be what they need. Families are particularly likely to be homeless at the point when their kids are young. If you can get them to the point where their kids get a little bit older and can start to take advantage of public schools, that can help. So even in very tough housing markets, most people manage to stay out of shelter most of the time, and a little additional help may be enough. But I think we still need to do more research to say how much help, how should it be structured, and all of you have the opportunities to experiment in your communities. You don't need to wait for national studies. You can try to see what works with the resources that you have, and then tell the rest of us.
I agree with that. Nope, agreed.
We have a question from someone who's watching the live stream in New Hampshire, which is, can you speak about family unification vouchers and how child welfare systems can work with state housing resources to preserve families when lack of housing may result in a child removal?
Wow. Would love to follow up offline when I get the real expert on the line with the requester. I'm not an expert on that.
There is another study going on, a demonstration project of permanent supportive housing for families who have both child welfare involvement and where a housing crisis is a part of what's the barrier to reunification or to the reason for placement. And there have been studies already of using money where housing is a barrier to reunification, giving vouchers for that purpose, and I think those have been quite helpful. But that is an issue.
Do we have any other questions? Any other questions from the audience? Well, in that case, I want to thank the speakers. I think it's clear from the remarks that people made that homeless families are TANF families, that housing is a platform that's necessary for the success of reaching success in TANF's goals, and also for ending homelessness, that HUD and HHS both are needed to end family homelessness, that rapid rehousing is a promising new strategy, but it's not going to work without a link to employment and to increased income. So this is a worthy goal. These are the most vulnerable families. They certainly are deep concern to all of you, to HUD and to HHS, and there's a lot more we could be doing collaboratively to solve the problem and reach our goal. So I want to thank the panelists not only for being here today and for their wonderful presentations, but really the tremendous work that they've done on this issue and the leadership they've shown. We're just so grateful for it, and it really is incredible that because of the good policy work that's happened, that homelessness hasn't really grown more than it has recently. And also I want to thank all of you, because I know many of you here have been doing this work and toiling in these fields in the states and at the local level, so thank you for that. Keep it up. There's some good new ideas coming out, and there's more that we have to do. So thanks so much.
Before everybody runs off, I just wanted to go over a quick housekeeping items. Just a reminder that the conference begins at 8:45 tomorrow, not 8:30, so enjoy your extra 15 minutes. And we're actually not going to start here in the ballroom. We're going to start with a series of breakout sessions and then come together again afterwards here in the Regency Ballroom for our final plenary session on incarceration and poverty. So thank you to a wonderful panel, and thank you all, and we look forward to seeing you tomorrow. Thanks.